Hi, my name is Dr. Kari Nadeau. Thank you so much for inviting me here today. I'll be talking about climate change, lung health for this wonderful Keystone e-panel on air quality and lung health in terms of micro to macro. So from the molecular to the macro epidemiological findings. So I think a lot of you already know that the effects of air pollution and climate change are increasing. They affect all parts of the body. What you can't see or smell could actually harm you from air pollution. There are many different types of sizes and toxicants in air pollution, as well as that pollution affected and increased by climate change. For example, there are effects on the skin, the lung, premature deaths and births, systemic inflammation. There's a lot of effects overall on the immune system, which is what I'll be talking about today. Importantly, with increasing extreme weather events that are associated with climate change, that's increasing mental stress and mental health issues in all ages. And that results in PTSD or post-traumatic stress disorder. Stress in terms of displacement and loss can oftentimes increase and compact the issues around climate change and air pollution exposure. In addition, longitudinal analysis has shown that there are increases in lung cancer deaths as well among adults. But importantly, what are the effects of air pollution and climate change in the most vulnerable? Well, I focus research on children and pregnant women. And importantly, when you look at the recent World Health Organization air quality guidelines, there are many areas of the world in which pregnant women and children under the age of 5 are living in areas in which PM 2.5 are particulate matter 2.5 microns that exist because of air pollution or unfortunately now more and more wildfire smoke. You see that a lot of the children and pregnant women in the world are living in conditions that far exceed the World Health Organization's PM 2.5 levels in their guidelines. And importantly, when we try to understand the microscopic, the molecular changes that are associated with air pollution and climate change and stress, for example, we can actually look at the genes of someone and we can look at that in their blood. And particularly when you saw the list of the health outcomes associated with air pollution and climate change, a lot of it does exist in the immune system. And so that's what I study in my laboratory and research team. We look at the immune cells, which are pictured there. There are many different types of immune cells. They all have different half-lives. Some of them turn over more quickly. Some of them last throughout our whole life, for example, more than 100 years. For some humans, and when we can look at those cells and do single cell analysis and sort those cells, we can actually look at their epigenetic profiles of their DNA. Because when pollution or when chemicals expose the human body or stress occurs, you can see these changes in the DNA of the fabric of our DNA is then modified. And we can look at that not only in that particular person, but also in their progeny. And so studying the effects of ambient air pollution and climate change during pregnancy and childhood is especially important since these are the individuals that are very vulnerable to climate change and air pollution. And so, for example, we study with collaborations with John Baums, who's here today. We have a project going on in Fresno, California in the Central Valley. And with that, we've been able to assess, thanks to our collaborations with colleagues at UC Berkeley, that where are the most potent changes in air pollution throughout our state in California? You can see in the hourly air quality indices there, combining PM and ozone. For example, in 2018, you see a lot of areas in California affected not only by air pollution associated with diesel exhaust emissions, but also wildfires. And wildfires in our state, especially around the world, are increasing because of land use management issues, as well as climate change and other parameters. So you can see there in our demographics of this population, we're looking at pregnant women, but also importantly, these are women that represent minority populations that are vulnerable and that have been associated with redlining and red zoning due to people of color and a lot of discrimination practices, unfortunately, in our country. And with that, we've been really focusing on environmental justice as to what to study and how to help these individuals. So just quickly, I'll talk about the results of that study, which is currently ongoing as well, we have shown that methylation levels in specific gene loci like interleukin-4, IL-10, and interferon gamma, these are important genes in inflammation and in allergies and asthma, and that they're associated with these pollutants, unfortunately, and they're sustained over multiple periods of time. We also showed changes in their immune cells and their immune system, and these results offer insights into how air pollution, especially now including wildfire smoke exposure, affects the pregnant woman during pregnancy. And we need more studies in epigenetics. Now I'd like to move forward with children. So thanks to, again, the collaborative work that we're doing in the Central Valley and through the NIEHS and EPA Children's Environmental Health Centers, we were able to map children living in Fresno, thanks to UC Berkeley and Fred Lerman at Sonoma Technologies. And with that, we also found that increases in polycyclic aromatic hydrocarbons, naphthalene and phenanthrene in particular, were increased in exposure analysis of children living in the Central Valley in California. And so here's, for example, demographic characteristics of some of these study participants in terms of the children. And again, many of them represent children in socioeconomic status, which is really in a vulnerable environmental justice population. When we looked at their immune systems, we did find through what we call Visney plots, these are looking at principal component analysis type structures with single cells of their immune system. And so you can see with higher exposures of PM2.5, a population of monocytes, which is a type of immune cells that's important for fighting infections, as well as responding to vaccines. And you can also see higher inflammatory markers like C-reactive protein. And with that, we were very interested in which cells were being affected by the pollution, and especially in children where these cells are very instrumental in helping them be able to combat infections and be able to sustain long-term immune health. In addition, we looked at outcomes. We were looking at asthma, but we were also looking at blood pressure outcomes. And we were very interested and intrigued to know that these immune factors and certain inflammatory mediators were correlative with changes in blood pressure. And I think this also talks and speaks strongly about the effect of air pollution and potentially climate change mediated wildfire smoke, that there's increases in cardiovascular symptoms even at young ages in children, and that includes blood pressure changes. So in general, we think there are direct and indirect effects of exposures, and this can affect a certain cell population. We've shown here the monocyte population, and that might be associated with diastolic or a particular type of blood pressure change in children. How this affects longitudinally, we're studying that now in terms of how it affects long-term cardiovascular illness. I'd like to move on to another air health issue in terms of lung pathology and what's happening in allergies and asthma throughout the world. Unfortunately, with climate change, there are increases in pollen counts, and we expect to see that over the next many decades, because as the planet warms and as carbon dioxide increases in the air, more and more pollen is being emitted from any individual plant, but you also see plants growing in areas in which they were not able to grow before because of the climate changing in warmth. And so here you can see, for example, in Europe, a pattern of increasing in ragweed seasons, for example, throughout the continent. We did a similar analysis of pollen and mold exposure changes over the past many years in San Francisco, the Bay Area in particular. And when we looked at this and looked at the same type of exposures, we also saw that the average time period over the last 17 years for pollen exposure was increasing by about 3 months. And so because it's getting warmer earlier in the year, there is an increased exposure to pollens. So given that, we really need to now focus on possible solutions. We understand that air health is very important to all of us at all ages. I've accentuated the issues around pregnancy and childhood today, and that There are issues with wildfire smoke, not necessarily all associated with climate change, but in looking at air pollution and smoke exposure, how can we best monitor this? What are our next steps in terms of research needs about the whole exposed zone? We call the meta-exposed zone, with lifestyle, behavior, diet, occupational issues, as well as analysis. This is all going to be important in the future when we look at those issues around climate change and other factors on our Earth and where we live, for being able to assess all these exposures for any one individual. So looking at the research effects of solutions and mitigation and adaptation to climate change, for example, looking at multiple exposure in any one individual, looking at composite markers that we can look at over time. And then also we need to study longitudinal exposures over the course of a lifespan, especially in those vulnerable populations. And so we look at solutions-facing research for policy-oriented outcomes. You can see, for example, for cardiovascular, of which I've shown one example with blood pressure changes in children, that we can actually look at research in the population level and individual levels, and that can help us define targets and help us define policy and advocate for policies to reduce exposures. We need more action. We need more research around that action, and looking at the new IPCC report, knowing that the time is now. There's an urgent sense of being able to look as researchers to be able to help and educate more about climate change, and especially where we are with being able to study vulnerable populations. I want to end with some hope and promise, however, and studying those types of interventions and implementation science is critical as we think about how to study that as researchers. Here's, for example, an article that was published in 2015 in which a change in ultra-low diesel use in the vehicles in California reduced a biomarker that is a surrogate for asthma exacerbations, especially in those with persistent asthma. And with that work that Dr. Balmes and our group had done, shown, for example, that certain exposures of polycyclic aromatic hydrocarbons, which are associated with partially combusted diesel exhaust, were associated with the numbers of methylated CpG islands in their immune system. And with that, we were able to bring that to City Council, as well as many other factors that were occurring at the same time in California, and over time be able to really push and advocate for a zero-emission bus rollout plan for the city of Fresno and other cities around that area. So it takes time, it takes energy, it takes being able to reflect on educating the community, as well as working closely with the community to help them affect change. And so we're really happy about these types of solution-oriented research. We need more research around cost-effectiveness modeling and case studies. This is a great example where a co-benefit of the children's health of the U.S. regional greenhouse gas initiatives were able to show cost savings with changes in policies. And then finally, we need to really think about, from individual level to policy level and global level, thinking about what change in values need to educate early in life, from shareholder to stakeholder. We're all in this together. There's a call for emergency action now. We know climate change is here. Now the next steps are clear. I'm very grateful for being able to talk here at the Keystone Symposium. And here is the community and our group at Stanford. And we are excited to work together to help. Thank you very much.